CCA Exam Review Part 3 with a I. Question 101. What is enterprise-wide compliance risk? Correct answer: risk that affects multiple departments or the entire organization. Enterprise risks require coordinated, organization-wide responses. Question 102. What is a compliance work plan? Correct answer: a document outlining planned compliance activities for a given period. Work plans are based on risk assessments and priorities. Question 103. Why is annual risk assessment important? Correct answer: it identifies new and evolving compliance risks. Risks change due to regulations, operations, and enforcement trends. Question 104. What is the purpose of compliance benchmarking? Correct answer: to compare compliance practices against industry standards. Benchmarking highlights gaps and improvement opportunities. Question 105. What is compliance maturity? Correct answer: the level of development and effectiveness of a compliance program. More mature programs are proactive rather than reactive. Question 106. What is a voluntary refund? Correct answer: returning overpayments without a demand from a payer. Voluntary refunds demonstrate good faith compliance. Question 107. What is payer enrollment compliance? Correct answer: ensuring accurate enrollment with Medicare and Medicaid. Incorrect enrollment can invalidate claims. Question 108. What is provider-based billing? Correct answer: billing services under a hospital's provider number. It requires strict regulatory compliance. Question 109. What is cost reporting? Correct answer: reporting financial data to government payers. Inaccurate reports can result in penalties. Question 110. What is financial relationship disclosure? Correct answer: reporting financial ties between providers and entities. Disclosure prevents conflicts and stark law violations. Question 111. What is a fair market value assessment? Correct answer: evaluating whether compensation reflects market rates. FMV supports compliance with stark and anti-kickback laws. Question 112. What is commercial reasonableness? Correct answer: whether an arrangement makes business sense without referrals. Commercial reasonableness is key to regulatory compliance. Question 113. What is documentation timeliness? Correct answer: completing records promptly after services. Delayed documentation increases compliance risk. Question 114. What is copy-paste documentation risk? Correct answer: using repeated text that may not reflect actual care. It can result in inaccurate billing. Question 115. What is clinical documentation improvement? Correct answer: enhancing documentation accuracy and completeness. CDI supports quality care and compliant billing. Question 116. What is telehealth compliance? Correct answer: adhering to regulations governing remote health care services. Telehealth rules vary by payer and location. Question 117. What is medical necessity denial? Correct answer: rejection of claims for lack of justification. Proper documentation prevents denials. Question 118. What is an advance beneficiary notice? Correct answer: notice to Medicare patients that services may not be covered. ABNS protect providers from non-payment. Question 119. What is utilization review? Correct answer: evaluating appropriateness of health care services. It prevents unnecessary or excessive care. Question 120. What is length of stay compliance? Correct answer: ensuring hospital stays are medically justified. Unnecessary stays increase payer scrutiny. Question 121. What is discharge planning compliance? Correct answer: ensuring safe and appropriate patient discharge. Proper planning reduces readmissions and risk. Question 122. What is readmission risk? Correct answer: returning patients shortly after discharge. High readmissions can trigger penalties. Question 123. What is value-based care compliance? Correct answer: compliance with quality and outcome-based payment models. Value-based care emphasizes results over volume. Question 124. What is population health management? Correct answer: managing health outcomes of defined patient groups. It supports preventive and coordinated care. Question 125. Why is transparency important in compliance? Correct answer: it builds trust with regulators and patients. Transparency demonstrates ethical operations.